but this is the one you're in today. So we would like to introduce Nicole Earls. She is the Director of Tribal Relations at Coordinated Care. Or wait, no, she's the Regional Tribal Liaison of Washington State Healthcare Authority. Sorry about that. I got ahead of myself. And then Twyla Millar. Did I get it right?
Malari.
Malari. Okay, thank you. Director of Tribal Relations at Coordinated Care, and Katie Ferguson, Program Manager of Apple Health Care Connections. So for this session, presenters, you guys will be, we heard you guys will be managing your own chat and your own slide deck. Let us know if anything changes. And then, all right, I think we're ready to get started unless you guys have any questions or anything. Amanda, did you have a question? It looks like you got your hand up there.
Sorry, no.
Okay, no problem. Are folks able to see the share screen okay? Is that coming up for you, Nicole?
I can see the screen, so
Perfect.
thank you. Welcome, everyone. Before we start this presentation on accessing health coverage for American Indian and Alaska Native youth in tribal or state foster care, I want to start with a land acknowledgement. We had some really amazing opening and blessings and opening in a good way already, but we also want to acknowledge that we are meeting virtually throughout Washington State on traditional territories of hundreds of indigenous nations. Many of these areas are covered by treaties signed between the United States and tribes under duress before Washington was even a state. Not written in here, but something that I'll reference is, as a part of those treaties, tribes reserved the right for access to health care. That is a very important thing for us to acknowledge as state employees, that we have that responsibility to provide good health care. And that's a commitment that I have made in entering into this space. I am joining from the northwest corner of the Olympic Peninsula between the lands shared by the tribes we know today as the Makah, the Quileute, the Lower Elwha Clallam, and the Jamestown Sklallam. And I honor and thank their ancestors and the leaders who are stewards of these lands. I'm especially grateful to have received knowledge about the medicinal and healing properties of local plants. And one of my other commitments in caring for this land and water is to share that harvest of healing plants with my neighbors to support preparations for canoe journeys and gifts to elders in the local tribal communities. In addition, Chapter 43.376 RCW requires state agencies to work with tribal governments throughout the state in government-to-government partnership and relationship. And so as state employees and contractors, we have that obligation to ensure that when we make an acknowledgement, these are accompanied by action and integrity in this space, and that we are all committed to improving systems and services for tribal people. And I will pass it to Twyla.
Thank you, Nicole, for that beautiful opening. Welcome, everyone. Today, my name is Twyla Malari. I am here on behalf of Coordinated Care. I am Diné, enrolled member of the Navajo Nation. My clans are Hanagathni, which in English is one who walks around, and Sitnagina, which is Black Streetwood clan. I am calling in from the Snoqualmie, ancestral lands of the Snoqualmie tribe. And as we begin our time together today, we want to ground ourselves with also sharing gratitude and a few words from Lifting Hearts Off the Ground, which is poetry translated from the United Nations Declaration on the Rights of Indigenous Peoples. And we do our best to also utilize this in the work that we do and the commitment to our tribal communities. And the poem that I want to share with you is much of the work is our responsibility, but it is also not ours to control. These words do not chart a path to reconciliation. They're an invitation to a relationship and a gift and a summons. So with that, we just want to remind everyone and take time if you need to step away for a break. I know we just got back from one, but we welcome that. And we also, I know this is the beginning of interacting with you all, but if you'd like, you're welcome to also place your name in the chat box. tribal affiliation if applicable, and where you're calling in from. We'd be happy to see where everyone is joining us from. With that, I'll turn it over to Katie. Thank you.
Hi, everyone. So Nicole and Twyla just were able to introduce themselves. Thought I would just do a quick introduction of myself as well. I am Katie Ferguson. I use she, her pronouns. I am part of the coordinated care team as our Apple Health Core Connections program manager. I am a second generation Italian American through my father and have Irish and German roots through my mother. And it is an honor to be here today. And then real briefly, we just wanted to share with everyone what our journey is going to look like for today. So healthcare is confusing, and then we add in the additional elements of just navigating what does healthcare look like specifically for our American Indian and Alaska Native youth. So we're going to start by just talking about having a shared understanding of language, knowing that we have all sorts of acronyms and all different definitions and ways that people think of things and hear things. We'll talk a little bit about how to access and what access to health coverage looks like for youth in foster care. We'll walk through a few different of those coverage options. One of them is Apple Health without managed care, also known as fee-for-service. We also have behavioral health services only, and we have Apple Health Core Connections. And then we'll also make sure that we're talking about care coordination options, including fostering well-being.
Okay, and we have a slide here mainly for folks to reference later on that shared language understanding. We are going to avoid just using an acronym without explaining what it is, but here are some of the key acronyms that we might use throughout this presentation. And one of them that I do want to highlight is the term American Indian Alaska Native, or AIAN. There are no standard criteria for determining who meets that definition, and many federal programs and laws use definitions that are different from one another. And one example is in the Medicaid space and in the ICWA, Indian Child Welfare Act space. So some, for the purposes of Medicaid and the State Children's Health Insurance Program, or CHIP, the definition generally includes individuals who are eligible to receive services from an Indian healthcare provider, meaning Indian Health Services or a tribal provider or an urban Indian organization. Those eligibility criteria are not strictly tied to tribal membership. ICWA defines an Indian child as an unmarried person under age 18 who is either a member or citizen of an Indian tribe or is eligible for membership or citizenship in an Indian tribe and is the biological member, right? I'm reading verbatim the ICWA definition. Just keeping that in mind, it doesn't change the way that a youth will be able to access Apple Health when they're in foster care, but it does make a little bit of a difference on the Medicaid space for the ability to opt into a managed care plan or opt out into that Medicaid fee-for-service. Wanted to keep that kind of at the top of people's minds. And then if you, again, when you get these slides, if you have any kind of questions about what those mean, this is our cheat sheet of some of those acronyms. One other one that you probably won't hear a lot in child welfare space is purchased and referred care. That's the PRC acronym for Indian Health Services and tribal clinics. There's a source of funding available for tribes to manage paying for care that isn't covered by any other insurance, including Medicaid. And that kind of leads us into the next slide. It makes healthcare complicated, and it opens up a space for people to maybe have assumptions about access to healthcare for tribal members that isn't necessarily true. So the tribal healthcare delivery system is probably one of the most complicated and confusing. Healthcare is complicated anyways. But instead of funding Indian Health Services at an equitable level, what the federal government has done and what Congress has done is relied on third-party revenue to keep Indian healthcare programs operating. That's what makes this so complicated. To the left in the funding sources of priority column, this is the priority of payment by funding source. So we sometimes hear that Medicaid is the payer of last resort. That isn't necessarily, that isn't true if it's a tribal member who has access to Indian Health Services dollars or to tribal government funds. The IHS and the tribal dollars are the payer of last resort. And it's really important that we don't just assume that someone has Indian insurance and is covered, that we make sure that providers know that if a youth is on Medicaid, that Medicaid is going to pay before the tribe is billed for a service. In the middle, we have a breakdown of the Indian healthcare facilities by type. So in Washington State, there are 3 federal facilities that are operated by the Indian Health Service. All 3 of those units are in Eastern Washington. And then throughout the state, there are tribal health facilities, also known as Indian healthcare providers. There are 27 tribes in Washington that have some level of healthcare services in their community. They provide direct care, and then they also have the management of those purchase and referred care dollars. Lastly, there are urban Indian organizations. Those include the Seattle Indian Health Board and the Native Project. So one on the east side and one on the west side. And then the last thing I think that is important to note is that healthcare payers, including commercial insurances, are required by federal law to pay Indian healthcare providers, even if they don't have a contract in place with them. So it gets complicated. It's probably the best kept secret of healthcare that there is a federal law that has those protections in place for American Indians and Alaska Native people and for tribal providers. And then just important to note that tribes in Washington generally are involved and would manage healthcare for their members in their community, and it varies depending on the tribe. So to the next slide, each tribe determines who they serve, and that eligibility might change in every tribal community and between different services within the community. So maybe in the child welfare space, we're used to thinking that a tribe will assert jurisdiction or be involved with every tribal child. That doesn't mean that that same tribe will have full access to all healthcare services for that child. It might just depend on their agreement with Indian Healthcare Services, with their ability to take on new clients within their clinic or within their mental health services. So it's really important to have a connection and to call and ask. Tribes also provide additional services that they may not bill for. Diabetic foot care, open immunization clinics, different things like that. Every tribe is different. And they sometimes influence the choice of the tribal members into the kind of plan for their Medicaid coverage. So that could be that fee for service or that managed care enrollment. And again, every tribe is organized differently. Some have all their services in one social and health services space. Others have separate departments. And so we always say, if you know one tribe, you know one tribe. And that every tribe is different, and it's, again, important to make those connections. Next slide. When I said earlier that tribes might influence that Medicaid enrollment options, so
Nicole, it looks like you may have froze.
foster care, which is that enrollment with Apple Health Core Connections for medical and behavioral health. And then Apple Health Core Connections has that care coordination available. There's also behavioral health services only, which is BHSO. And that means that the medical services are billed directly through Provider One to the Healthcare Authority, and care coordination is provided by Fostering Wellbeing. I saw Shania here earlier, so we have one of our the the fostering well-being contact here, and I'm glad that she is here. And then those behavioral health services in a BHSO would be provided by the managed care plan that the individual chooses. So there are 5 in Washington. And that care coordination for behavioral health services is provided by that managed care plan that's chosen. And we have a slide that breaks down all of the managed care plans. And then the last option is fee for service, which is Apple Health without managed care. You might also hear open coupon. I still hear that sometimes in meetings, that someone just has Medicaid and it's this open coupon. That means that medical and behavioral health services are provided fee for service through Provider One. And again, for youth and foster care, that care coordination is available through Fostering Wellbeing. One key note is that dental for all youth is always fee for service through Provider One. So dental is what we call carved out of managed care. Another service that's carved out of managed care is non-emergency medical transportation. So both folks in the customer service center at HCA or in the managed care plan customer service should know if a service is covered by Medicaid but carved out. If you're running into bumps with access to something that you're like, I know this is covered by Medicaid and I can't figure out how to get it for this kid, you can always reach out and ask. And so when a youth has complex dental needs, for example, that care coordination for their dental is also through Fostering Wellbeing. Next slide. We wanted to briefly talk about how youth in foster care get put into Apple Health for their foster care medical. So if there's a DCYF placement, that means that FamLink has the data in there and they send the information to Provider One for the foster care medical to open. So the foster care adoption support team assigns that youth to Apple Health Core Connections unless they're American Indian, Alaska Native, dual eligible, or a non-citizen. There are a few exceptions where someone wouldn't automatically be enrolled into a managed care plan. If they are opened in a DCYF case, but transfer to tribal jurisdiction, the foster care medical would have been opened through that FamLink process. But when the tribe asserts jurisdiction, there's a different step through the 1927 form. Those changes, if the youth changes placement, if their address changes, if they want to make a different selection for the coverage, all of those can be done by that 1927 form. So youth stay on foster care medical, but that's how updates are made. They're not made through FamLink anymore. The last option is when a youth is opened in a tribal placement without any DCYF involvement or case being opened. The Healthcare Authority relies on the tribal social worker to send that 1927 form into the foster care adoption support team. And the tribal social worker is the one who chooses if they want the youth on Apple Health Core Connections or if they want them to remain in fee for service. They also have the option to be in BHSO, but the form doesn't have those boxes yet. We're in the process of updating it. When it's updated, we'll be sharing it broadly throughout every channel that we have so that tribes know that the form's a little bit different now. But you can always call or email the foster care adoption support team and ask. When in doubt, get a hold of us and we can help. Next slide is the link to those foster care forms. So the 1927 is the form for opening and making any changes. The 1928 is the form for youth who are aging out of tribal foster care. That lets HCA know that they're going to be transitioning if they choose to go into the alumni program, for example. And it provides a contact for that youth so that they can reach out to them and be able to make changes or contact them to know what kind of medical that they want when they're in that alumni program. So One of the other changes we're working on is combining these so that it isn't quite as confusing. Hopefully having one form simplifies the process. Again, that's in the works, but wanted people to know that that's coming. Next slide. We wanted to break out those two managed care options and provide you all with links to more information. I feel like I'm talking really fast and I'm sharing a ton of information. So I want everyone to be able to go back and do the research and learn a little bit about what this is. So integrated foster care, again, is the managed care plan of coordinated care, Apple Health Core Connections, and Katie's going to talk more about that. The BHSO is when a youth is in a managed care plan for just behavioral health services. So that's usually the inpatient mental health or substance use disorder treatment, those higher levels of care for behavioral health. We have a link to a BHSO fact sheet and then the contact information for every MCO in Washington. There are 5. All 5 have a tribal liaison or a contact who's serving as the tribal liaison right now. And that PDF will give you all that contact information. Next slide. I mentioned care coordination. And that is also something that Katie will talk a little bit more about. But for coordinated care, that's part of the member health benefits. That care coordination is something that is available for youth who are in fee-for-service. That care coordination is provided by Fostering Wellbeing. They are a small but mighty team, and I'm always impressed when I hear how much they're doing for youth in fee-for-service and for all of the youth in the dental area. Under there is a link to the Fostering Wellbeing referral form. So important for youth who are in a tribal placement. If you want a youth to be able to access that care coordination benefit, that referral form is really important for Fostering Wellbeing. And again, when in doubt, reach out and we can help make connections. And then next slide, also more options and supports for youth who really need a long-term inpatient program for behavioral health, who have really high needs. There is the CLIP program, and that admission is just a little bit different, just enough to have me still being confused. But there are supports available through the managed care plans and also the behavioral health administrative services organizations. So we have all of those contacts in this link on this slide. And again, we can always help with those connections. And then we also have the Tribal Resource Hub. They are slowly growing their resources and connections, but they're a great contact for tribal services available when a youth is in crisis or needs help finding an inpatient bed and maybe doesn't have someone who can support that in the managed care plan, or it's an emergency and you just need someone, they need someone to call and talk to at 3 o'clock in the morning. The hub is available. So with that, I will pass it over to Katie to talk more about coordinated care.
Thank you, Nicole. I know we were just talking about care coordination. So because in healthcare, we like to use confusing terms, I'm now going to be referring to coordinated care, which is the company name, not the service. And so I'll be sharing with you a little bit about that today. So I wanted to give you a little bit of background for who is coordinated care, just to kind of give some context behind us, because I know it can be confusing hearing all these different companies and Apple Health this and Apple Health Core Connections. What are all these things? So wanted to share with you today. So coordinated care is one of the 5 managed care organizations that Nicole mentioned in Washington that offers free or low cost health insurance plans to individuals and families in Washington state. So we're local. We have about 200 staff that live and work across our state here. We have a physical office located in Tacoma. We employ care managers, social workers, community health workers, provider network specialists, care liaisons, call center representatives, so many folks. And together we serve more than 300,000 members statewide, offering health coverage through 4 different healthcare plans that you see on your screen here today. So we have our Medicaid managed care, which we just call coordinated care. We have our foster care medical that Nicole was mentioning, which is our Apple Health Core Connections. We have private insurance, which you can purchase from us through the Washington Health Benefit Exchange. That's called Ambetter. And then we have our Medicare Advantage, which is what we call WellCare. So if you hear any of those plans, all of that is coordinated care. Just wanted to set that stage. So it's a lot of different things to navigate and figure out who's who, but wanted to just give you that background for who we are. So again, today we're specifically talking about Apple Health Core Connections. And when a child enters foster care through the state of Washington, Nicole shared that typically they're automatically enrolled into this specific health plan. It is specific to youth in foster care. However, there are some exceptions, and I'll come back to that in a moment. So the Apple Health Core Connections plan covers about 20,000 plus members statewide. Those are going to be youth who are in foster care, state or tribal, potentially, adoption support, the guardianship assistance program, extended foster care. It also covers young adults until age 26 who aged out of foster care. Youth who are reunified with their families, they're able to stay on this plan for 1 year after the case officially closes. And we also have youth who are recognized by the United States federal government as unaccompanied refugee minors. So as we just mentioned, most of the time, the Health Care Authority will automatically enroll those youth onto Apple Health Core Connections. Once the data is entered into FamLink, they see that placement, the Health Care Authority is notified, and typically they come onto this plan. However, some of the exceptions include, there might be private insurance, or if the youth is incarcerated, that coverage would be on pause. And additionally, youth who are identified as American Indian or Alaska Native, whether they're recognized by the tribe or not, they don't automatically enroll into this foster care health plan, and they're entered into fee for service. So enrollment for AIAN youth into Apple Health Core Connections is voluntary, and it does require some proactive enrollment for AIAN youth if that is what is chosen. So what happens when youth come onto the Apple Health Core Connections plan? Well, all of our members, and typically it's the caregiver depending on the age, they'll receive a welcome call from us within the first couple of months of joining our plan. And this call is going to come from our care management team, all of whom are trained in trauma-informed care, and they have experience working with governmental agencies like DCYF to meet the wide range of needs for youth. During the welcome call, our team will ask a series of questions to help identify healthcare coordination needs, including cultural considerations, and we'll answer any benefit questions. And when youth on our plan are getting close to turning 18, we'll reach out to try to connect with them to empower them on how to use their health plan as they enter into adulthood. We ask them questions to find out if there are any physical or behavioral health needs that we can support with, things like finding a doctor or a therapist, as well as other social drivers of health that we can support. We'll ask them about their education, their housing, employment plans, and we'll offer resources in the community to help support them as they transition into independence. In addition to our care management team, we also have a health liaison in every DCYF region who can help with coordinating with our Apple Health Core Connection staff, our healthcare providers, or just any kind of issues that seem to arise. And our liaisons are really focused on promoting effective communication between DCYF with coordinated care, with members, caregivers, parents, providers, and tribes, in partnership here with Twyla, who's joined us as our Director of Tribal Relations. And they're really particularly helpful with trying to understand all these different coverage options for our AIAN youth, or for members that are just needing some support. And, maybe they are going to an Indian healthcare provider and they want them to be assigned as their primary care provider. Our team will be able to support with that. And then lastly, we have a community education team, and they provide free clinical trainings to caseworkers and caregivers on a range of topics from trauma-informed care to self-care to how do I support LGBTQIA+ youth to, understanding more about fentanyl and naloxone. So, and they also offer some caregiver support groups as well. Healthcare coordination. So members, caregivers, caseworkers, and providers can request care coordination from our team at any time. And we'll help with finding providers, like I mentioned, or coordinate care for members who might have multiple needs and services. And we'll help access just a variety of resources, including medical supplies and community resources. A couple of examples might be, a child's primary care physician might have made a referral to an endocrinologist, but that specialist doesn't have any openings for 6 months. Our team can call around and figure out who is available sooner and get that connected. Our care management team is very committed to person-centered care, and we'll partner with members, caseworkers, and caregivers to really identify the challenges, strengths, and goals of each member and develop a care plan. And we really try to take a holistic approach to this and incorporate culture into our care plans, because we recognize that there are multiple elements to healing and wellness. So for example, if we're supporting an AIAN youth, our care management team might talk with that youth or their caregiver about, access to familiar foods. And maybe for this kiddo, they're used to gooey duck. And how do we incorporate that into their healing plan? Or maybe they need access to drumming or beading or other practices that can be really therapeutic and healing for our youth, particularly if they're placed outside of the tribal community or with non-native caregivers. And then this is just some information about how do I access care management? So on the right-hand side, you can see the phone number that you can call, or you can email us. And on the left side is the information we will need from you, either during that phone call or in that email to us. So if you can share with us the name of that youth, their date of birth, if you know their coordinated care member number or their provider one number, just contact information for who we want to be in touch with, a good phone number or email for them. And then letting us know if there's tribal affiliation or citizenship, or what the child welfare jurisdiction is. Is this a tribal dependency? Is it a state dependency? And then just any information about the need or the requests that you might have. And then we have a few things that are unique to us as Apple Health Core Connections and Coordinated Care. And one of those things is the Foster Care Center of Excellence. We have partnered with a few providers across the state to develop the Foster Care Centers of Excellence model, and it serves as an integrated and trauma-informed medical hub. So they provide services to members on a one-time basis, or they can serve as a primary care provider. They can provide specialized services for our members, including getting that EPSDT well child exam within the 30 days for when a youth is entering into foster care, or making sure that those kiddos can come in for at least their initial health screening within 5 days when that's needed. They'll refer or provide behavioral health services, referrals to specialists. They can help with durable medical equipment, all sorts of things. And our care management team works really closely with these centers of excellence to provide support and following up on those referrals and really trying to improve the health outcomes for our members. We're continuing to expand our centers of excellence across the state. You can see the 5 on the screen that we currently have. We are hopefully going to have one soon here in Central Washington, which is really exciting. We're also looking to get one open pretty soon here in the North Sound as well, to ensure that we have at least one in every DCYF region. And then the last couple slides we just wanted to talk about are some value-added benefits. So with healthcare, again, it can be so confusing, right? So the coverage for medical and behavioral health services, as well as pharmacy services, are going to be the same, whether you're on Apple Health Core Connections or fee-for-service. So those things are covered. That's what Nicole was mentioning. I know that this is covered by Medicaid, but there might be just different ways for how you access what that looks like. One thing that is unique is if a youth is on our Apple Health Core Connections plan, we do have value-added benefits. These are things that they're only going to be able to access if they're on this plan. The first one you see that's listed here is a partnership that we have with the Washington State Department of Health and Safeway to offer fruit and vegetable prescriptions throughout the state. And these are $10 vouchers, up to $100 worth per year, where you just bring that voucher to your Safeway and you can get fresh, frozen, canned fruits and vegetables, nothing with, the cheese and the sauces, but really it's meant to try different things. And I've talked with many members who have said, I just tried kiwi for the first time. And it's just really lovely to hear and to expand that palette and use food as part of our healing. Another program we have is our rewards program. And this is essentially us saying, hey, we want to reward you for taking care of yourself. So you can see on the right-hand side that we will actually provide a prepaid Visa card and load money onto that card for our members when they complete things like going to their annual wellness visit. That's $40 that we'll put onto a prepaid Visa card that can be used for all sorts of things. The only limitations are, you can't use it for tobacco, alcohol, or firearms. But other than that, you can use it to pay your Netflix account or, pay the utilities bill, whatever that might look like. I will say that for youth in foster care, one thing to note is that if you've been working with youth and this sounds like an unfamiliar benefit or something that hasn't been received, What's tricky about the program is that the card is sent one time. And then you keep that card and the money gets automatically loaded when you complete other things. So if you went to get your annual wellness visit, you would, and that's the first thing you've ever done since you've come onto our plan, we'll send out that card. And then, 3 months from now during flu season, if you get the flu shot, we'll automatically load that money onto your card. There's nothing that the member needs to do to receive that because we get that information from our billing team that says, hey, so-and-so just went and got this visit, and so here's some funding onto their card, and it automatically happens. But because kids are changing placement frequently, or at least they might change placement at least once, and there's so much paperwork and so many things that don't necessarily stay with those kiddos, it's possible that, the next caregiver doesn't have that card. And so I would just say, if you give us a call, we can go ahead and send that card out to you. So if this is a benefit that doesn't sound familiar, and you said, I've never received this card before, give Coordinated Care a call and we'll happily look that up and make sure that we send out a new card to you as a caregiver or on behalf of the member you're supporting. And then lastly, these are just a few additional benefits we also wanted to just share with all of you. I think some of the more popular ones that we have, in addition to the Harvest Bucks and to our My Health Pays Rewards program, is an annual membership that we'll pay for the Boys and Girls Club. We also have a Start Smart for Your Baby program. So this is really intended to support pregnant moms, pregnant folks who, will support not only in helping them with their medical appointments and just kind of coaching them through different things that they'll need to know on their journey of pregnancy as well as postpartum, but we'll support with tangible items too. They'll get a no-cost breast pump, and they'll get to choose between a stroller, a car seat, or a pack and play. We also have our 24/7 app with access to doulas and many resources, breastfeeding consultants, really just trying to support the health and well-being of mom and baby. And then a few other things are listed on here as well. We have eyeglasses, $100 for glasses for members 21 and over. If folks are in fee-for-service, they unfortunately wouldn't have their hardware covered. And so we're happy as a managed care organization to be able to throw in this extra benefit to try to support our members in getting the glasses or their contacts every couple of years. And we also have telehealth services available. We have 2 platforms. One of them is Teladoc, and that's where you can access, just different things. There are behavioral health services through Teladoc for those who are 18 and older on our plan. But otherwise you can use it for cold, flu, fevers, sinus problems, anything like that for all ages for our youth. And then we just launched another telehealth service, MD Live. And this is actually, all the medical services are the same as what is offered through Teladoc. But what's different is that we're now able to provide behavioral health through telehealth services through MD Live for kids who are 10 and older. So we're working out some of the quirks there in terms of, security around access to these accounts and everything, but we're super excited to be able to offer that, knowing that we have a lot of youth across our state, especially in rural areas, that could really benefit from having behavioral health services provided virtually. So with that, I'll turn it back to you, Nicole.
I just get to ask if there are any questions.
I did gather one question from the chat box. Maybe we start there and then go to the chat or hand raise.
Okay.
Does that sound good? The question is, it said this is not specific to foster care children, but it may relate to the pathways you use to connect children to healthcare. Is there a specific liaison or sort of help to help find healthcare services or referrals?
The question is, and then I froze.
Oh. Could you hear me?
Now I can.
Oh, okay. I'll put it in the chat as well. It says there's not a specific, this is not specific to foster care children, but it may relate to the pathways you use to connect children to healthcare. Is there a specific liaison of sort to help find healthcare services or referrals? I'm not sure if that's an HCA question or both HCA and coordinated care.
It feels a little bit both. I think with coordinated care and with the other managed care plans, it would be through that care coordination service that's available. And then for foster children, I think we would potentially look to fostering well-being to help support, but we also have a slide in this presentation with the information about the regional tribal liaisons. Do you want to share that one? So this is our little map of over each DCYF map in the regions. We've circled kind of what our regional tribal liaison regions look like. And on the slide after that is the contact information for Office of Tribal Affairs. And then do we have the regional tribal liaison contacts? So I'm on the peninsula. And then Raina Pione is on the east side. In the North Sound is Tina Anderson. And then the Green Bubble, South Sound, King Cascades is Jaron Heller. And all of our contact information is there. There's no wrong door at OTA. You could email any one of us on this list or that tribal affairs email at the top, and we will get you connected to the right folks who can help.
And if it helps to know as well, for coordinated care, if you know that they're on Apple Health Core Connections, or even if you don't, you can always contact us. Included in the slide deck here, which we've dropped in the chat, is also our liaison map. So we have sort of our general line number for our Apple Health Core Connections team and our email address, which you can always reach out to, or who your local contact is for our plan based off of the DCYF regions, which you can kind of see. We've got 3 different health liaisons depending on which region you're in, and you're more than welcome to reach out to them as well.
And then we have one more question in the chat. It says, is this something a young person releasing from Green Hills would be able to sign up for? It sounds like signing up for coordinated care, perhaps.
I think it would depend on the situation for that kiddo, right? So if they were in foster care and then they enter into Green Hill and then they're transitioning out of Green Hill back into foster care, or aged out of foster care during their time while they might have been in Green Hill, then they would come to our Apple Health Core Connections plan, if that's the plan that they had been on. Otherwise, they might be fee for service if they were, American Indian, Alaska Native, but had not opted to join our plan. Other than that, I would say if they qualify, just in the same way that any adult or child would qualify for Medicaid, they can certainly join coordinated care as one of the managed care organizations, or they can join any of the others as well. So Nicole, I don't know if you want to add anything onto that, but I think it just sort of depends on the situation for that youth and what they would qualify for.
For youth transitioning out of juvenile detention or jail. So there's the suspension, but there is the same day process for opening a youth or individual who's exiting any kind of correctional facility or incarceration to get their Medicaid opened the same day that they release. There's also work going on to connect folks to some Medicaid covered services while they're in custody, for I think 90 days pre-release is what we're working on. So I don't have a lot of good information about that, but I do know that, if someone is leaving a facility, a correctional facility or juvenile detention, that they should get reconnected to Medicaid if that's back to coordinated care or to their other managed care plan or to just fee for service. That is definitely available. Yeah. And we can support, if you want to reach out to any one of us, we'll get you connected. I think one other thing I can offer from the regional tribal liaison perspective at the Healthcare Authority is if you are with a tribal child welfare program and maybe you're new or maybe you're not sure if those forms have been sent in and if the youth in care have Medicaid coverage, you can also reach out to us and we can support finding out. We can set up a meeting and just do a really quick double check of kids on the caseload and make sure that they have the right type of coverage. I have done that with a couple of tribes in my region, and we've identified youth that were somehow missed or somehow accidentally had their coverage ended, and we've needed to get it reopened. So we are available to help with that if that is something that you think would be a benefit to youth in care.
All right, we have about 4 more minutes. If there's any more questions, feel free to put them in the chat or you can come off mute. We'll wait about like 1 more minute and then we will finish up here. Oh, you guys got something too.
Yeah, we just want to, on behalf of Nicole, Katie, the HCA and Coordinated Care, thank you for welcoming us to this space today and just opening up for us to share this information. We hope we can be a good support and relative moving forward. So I will place the deck again at the end of the chat. Our contact information is there. And if you can take time, I know you all have probably been online all day today. So just a reminder, care for self, take a break, take a walk, get some water, and thank you for sharing space with us today. Yeah.
Thank you so much, Twyla, Nicole, and Katie for sharing with us today. Everyone, we will have a short 10-minute break after this before our closing keynote. Ours will actually be maybe 13 minutes. So we'll come back at 3 o'clock. We'll put the Zoom link in the chat for the next one. And once again, I just raised my hands to you. Thank you so much for coming and presenting here. We really appreciate it. We'll see you in 12 minutes.